Thank you everyone for joining us on this week's edition of EnviroScope, WADR's 30-minute program where we discuss issues relating to the environment, agriculture, land exploration and climate change, and every other matter that concerns our planet, Mother Earth. We are streaming live on WADR.org and on radio 94.9 FM, Dakar, Senegal, in the Gambia via Numi FM Banjul, in Nigeria on Albaraka Radio, and in Ghana via Radio Pod, Savannah region. In the next half hour, reports and interviews will come your way on today's topic, environmental disease. I'm Abdullahi Hassan, your anchor. As I said, we are taking a look at the relationship between environmental diseases and the population in this episode of the program. Disease interconnections between populations, that is, animals or plants, behavior, and the physical world, including factors related to habitat. Human conduct and handling of the environment have significant positive or negative impact on the society and immediate space we live in. Allow me to provide a bit more clarity on the relationship between man and environment with a submission by migration experts who blame climate change as a major driver for the recent surge in migration. Mohamed Mane is one of them.
Now, in the Gambia, we're seeing more of climate change issues. So the Gambian youth who are leaving from communities that are not known for migrating. Before migration had regions are affected by migration. Like, for example, the Upper River region of the Gambia, because there's an area where little social amenities are available. People don't have any hope. But now those that are even having the ozone, those that are having access to tourism, those that are having access to gardens are the very people who are leaving. So this is because there's a climate change.
Well, that is established. Malaria, cholera, hepatitis A, and other forms of diseases are caused by unhealthy environments, especially in low and middle income countries. Liberia is no exception.
Both of the cases from here, because malaria is a common sickness among our people. Here? Yeah, because of the dirtiness of the environment, and you see, Sony can be clean this time, so it's a breeding place for mosquito. So as a result, our people getting sick every day from malaria.
Are you aware that the inappropriate disposal of toxic waste, chemicals, used instruments or equipment from facilities such as medical laboratories constitute a grave danger not only to the environment but humans? The Ghanaian government, mindful of the consequences, this week commissioned the first of 14 medical waste treatment facilities.
What we do here is that we have microwave treatment systems that are able to treat every form of hazardous medical waste from the various healthcare facilities to render them harmless before disposal.
If you are just tuning in, this is EnviroScope, a half-hour environment program on West Africa Democracy Radio, Dakar, Senegal, and streaming live on WADR.org. And today, we are looking at environmental diseases where we have notable examples such as malaria, cholera, Lyme disease, and West Nile virus, among others. While the rainy season setting in most coastal states, which brings about flooding, the propensity of increases in the spread of waterborne diseases such as hepatitis A and cholera widens. Receding flood water can create stagnant pools of water which provide the perfect breeding ground for mosquitoes which can transmit malaria. Let's begin with some data by Ogie Obiorika on environmental diseases.
Wherever you live, your health is impacted. Around the world, more than 50 million people die every year from disease, and 1/4 of those deaths are directly caused by environmental factors. The World Health Organization says 1,400 people every hour of every day die from an unhealthy environment, with the hardest being those in the low and middle income countries, especially in Africa, Southeast Asia, and the West Pacific. The young and old are most affected. More than half of the world live in urban areas and can face air pollution, poor housing conditions, and limited access to clean water and sanitation, among others. Currently, climate change, experts say, presents new challenges and further aggravates existing ones. In preventing the spread of infectious and hazardous environmental-related diseases, the UN Health Agency proposes simple measures to protect our health and the environment. These include safely storing and discarding toxic substances at home and workplace, dispose of waste appropriately away from water sources, and introduce clean air technologies as well as smart energy solutions to minimize climate impact.
Oge Obiarika with that report. In West Africa, no country is spared of environmental diseases like malaria, whose treatment in some countries in the sub-region is a huge challenge, especially for those in the farthest communities. A 2018 statistics from the World Health Organization WHO showed that malaria deaths in Liberia reached a record high of over 1,918, or 5.72% of the total deaths. In this report, WADR's Monrovia correspondent Darlington Popper tells us that a case management report shows that children under the age of 5 and pregnant women are the most affected groups.
The report also found that malaria remains the leading cause of sickness and mortality, accounting for 34% of all outpatient cases and 48% of all inpatient cases. Children under the age of 5 years account for 35% of all malaria cases and 34% of all inpatient deaths. With these statistics in hand, I headed to Soniwen, a slum community where I met 54-year-old Kola Kuli, who has lived here for 20 years. He says people here are living with malaria due to the filthiness of this community.
Both of the cases from here, because malaria is a common sickness among our people.
Here?
Yeah, because of the dirtiness of the environment, and you see Soni can be clean this time, so it's a breeding place for mosquito. So as a result, our people getting sick every day from malaria. I'm really worried about it. I'm concerned about it, but I don't have nothing to do with it. Only the government can come in and help us, to cover these places. But common citizen alone, I can't do anything. Yeah, so we need the intervention of the government so that the flying of mosquito will stop, or the breeding of it. So we really need with our mosquito net. Actually, we will carry our kids to the hospital every day.
Nathan Kwame is a Liberian. He resides in the Buzo Quarter community, about 10 minutes walk away from the executive mansion up on Capitol Hill. He tells the WADR malaria cases are widespread here.
As I told you, my son's sick and my wife's sick.
What is happening to them?
My son is malaria. And came to the hospital the Thursday, that malaria on so I did again treatment.
So what type of treatment do they give you at the hospital when you get there?
Injection, amodiaquine, paracetamol, and they call what you call amoxicillin for the cool. I saw us you can get a char, but the woman is now to and buy.
Are you worried that this will keep happening if the environment remains as it is?
No, the thing all in Africa, meaning in Liberia, to treat the system will be very hard because there are a lot of stomach people walking on the street, they eating, they dropping dead. So for I to tell you, in the community for it to stop, I can stop it. Anyway, you see a dead area, water area, no mosquito there.
The Soniwen Health Center is situated in this community. I have come over to speak with hospital staff here, but no one is willing to speak with me, as I am being pushed around by the officer in charge and her team. With that unfavorable reception, I drove over to the Sinko neighborhood where I met the head of the Grace of God Medical Clinic, Thomas Holoba, who explained how malaria is treated here.
Most commonly we use the rapid diagnosis test because we want to get them coming fast, but there's a cleaner area. And most of the as soon as we do the test, you see the reading positive, then we go ahead to treat. There are a lot of cases that we receive in different disease conditions, but malaria happens to be the prevalence among all. The highest case that we receive on a daily basis, 70% of the cases we receive a day are malaria related. Most of our patients are children under 5. Children under 5 are most often down with malaria when they bring them in this area. Malaria with some